Hello, and welcome to The Spark, a view of innovation in healthcare. I'm Rachel Schreiber, your co-host, and in this episode, we're thrilled to share the spark that ignited the creation of this podcast. I'm joined by Stuart Hansen, our CEO and a longtime innovator in healthcare.
Thanks, Rachel. I'm so excited to get this started and engage in this first inaugural episode of The Spark and just share a little bit of information with our first listeners on what we're going to be covering during this series. I also want to share a little bit of the inspiration for why I got so excited when you approached me with this idea to do a podcast. We've all heard the expression, necessity is the mother of invention, right? For those of us in healthcare, and you've been in healthcare for a long time, I've been in healthcare for a long time, we all realize that it has never been more obvious that there's real necessity for change in healthcare. There's so many new technologies and such a differentiation in the experiences that we have between healthcare and other industries where it's more fluid and data is more prevalent and easily accessible. But also the necessity is really driven by the struggle that couldn't be more real, especially for healthcare providers. They're struggling with financial viability. They're struggling with physician burnout. They're struggling with frustrated patients, and they still struggle with limited access to the data they need when they need it to provide the patients with the best care possible. So I guess, in other words, necessity is here in healthcare. And we all have to also recognize it's very hard to really innovate, to really invent, to really change things in healthcare. And it's hard because it's so complex in this industry, right? The data all needs to be protected. It's also really complex data sets. And it's all based on experiences in different organizations and different systems. And not to mention, there's not full alignment of the incentives between all of the parties involved in our insurance, from our employer perspective, from our insurance company perspective, our doctors, our physicians, our specialists, our hospitals. So those incentives are not always aligned, and sometimes the systems aren't even connected. So anyway, I think what's going to be exciting is talking to people that are dealing with some of those challenges in unique ways. I know we've got a great slate of initial speakers we've got planned for this series that are lined up and are all tackling some of healthcare's hardest problems. And I really think that, what's interesting about all of them is they're all trying to do disruptive, innovative, meaningful invention. They're all ingenious. They're all going about things a different way. And there's such an opportunity to change the lives of humans through some of the things that we're aware of that are happening in the industry. So for too long, it's the industry's been kind of bogged down and trapped in this complexity and lack of collaboration and fighting just basic technology challenges. I think now is the right time. And I think now we're going to have a lot of really interesting discussions with folks around this.
Yeah, that is so true. And it'll be really interesting to hear how organizations are looking at their processes differently and considering the patient experience. It's great that healthcare organizations are using AI, but there's an issue when they're using it to automate a broken process. So we've seen the headlines about that when they don't look at, take that step back and look at what they're doing and how it's going to make an impact on physicians and patients. There's a negative result, and we need to be using AI smart. So that's an example of innovation that could be great for healthcare, but we have to look at the infrastructure, look at the processes, and be brave enough to challenge those.
Yeah, well said. One other thing I wanted to do as part of this discussion is just share a personal experience that really helped open my eyes to the concept of disruptive gets so overused, but truly disruptive innovation or truly possibility thinking based approaches to old problems. So about 10 years ago, I was asked to chair a work group within HIMSS called the Revenue Cycle Improvement Task Force. I ended up holding that role for 2 years, and we did a complete reset of that task force. So we took a fresh look at who we wanted to have engaged, and we ended up assembling a group of leaders from payers, from providers, from technology companies, outsourced revenue cycle management. We had a payments company or two represented, financial institutions. And so that was number one. We brought in a bunch of different perspectives, right, where they also all share this common patient experience, which is a cool part of, bringing people together. Now we all have got war stories or examples of things that we would like to improve, maybe put a more positive spin on that.
Right.
But we assembled this group of folks, and then we had an amazing facilitator from HIMSS that was helping organize the series of workshops. And she asked everyone to check their roles, check their organizations, check all of their biases at the door, right? And really sit in the room as humans who experience healthcare from
That's
different
great.
perspectives each. Yeah, it was really cool. And she asked us to engage in what she called possibility thinking. And, that's everybody, you can just hear that and know what it means, but I hadn't heard that term before, right? Possibility thinking. Like everyone's like, oh, you got to think outside the box or you've got to put aside your biases. But she basically said, hey, let's just engage in thinking about what could be possible, what should be possible. How should revenue cycle work? Or forget about how it needs to work. How should a patient experience the healthcare system? And what would that require, right, of data moving between their payer and their provider or from different payers to one another for referral-based care? And just forget about the data silos, forget about the technology tools and the barriers and the limitations of those, and really engage in this possibility thinking. It took us a while, honestly. Like the first half hour, people were a little bit awkward, right? But it's like a 3-hour session. We had, good food brought in. And as people started to really embrace that idea, we ended up over the course of, I think we did 3 or 4 workshops. We ended up with a really inspiring vision for what could be done for healthcare from a patient's perspective. And I know a bunch of the folks that were in that room are still engaged today with one another, collaborating, talking about problems, and really trying to tackle and embrace that vision and move the industry forward. And we're not obviously just going to be talking to, a group of people that were assembled 10 years ago by HIMSS, but we'll be talking to a few. But we've got a great list of innovators and thought leaders in the industry assembled to have conversations with us. And I think this common thread we're going to hear from all of them is that at different points, they've had different inspiring moments like that opened their minds to possibility thinking, right? Maybe it was a really bad experience with one of their family members in the healthcare system, made them think about something a different way. But the end result is I think we're going to see this common thread of people thinking outside the box and really tackling things and some of these big challenges in a different way. And that's what I think the Spark is going to become.
And I want to build on what you were saying about collaboration, because that's key. And there are so many organizations out there that recognize that payers, providers, other stakeholders need to work together. And that's what's really going to change the processes and make healthcare better. Innovating in a silo has gotten us this far, but there's so many more possibilities when we work together. And, being part of Avenir Health from its early days, it's been exciting to see how we'll bring together people in a room to, talk frankly about how to improve a process and working together. And we're expanding and bringing in more examples of other companies and other organizations and other initiatives that are working together to make things happen. And looking at taking a fresh view of the processes and the workflows and the infrastructure that's needed for healthcare to truly work well, where the data, as you were saying earlier, is immediately available because we know it's possible. We get our, we go to ATMs and we can see our balance no matter where we are. And that can be possible in healthcare. So we're excited to talk about those innovators and the other people who are making a difference.
Yeah, I think that's right. And I think, the interesting thing about all of my experiences around engaging in projects in healthcare that get people excited is this thread, right? This thread of thinking about things a different way and actually opening your minds to work with your trading partners who might be adversarial contracting parties, right? Mm-hmm. And sometimes it's hard to find the mutual win-win situations. There are more and more of them, I think, available as we start to think more and more about the patients, the humans, the consumers, the members, that we're actually all here to serve in healthcare. And so I think the discussions we're going to have here are, with these change makers in the industry that are really looking at things differently and really focused on significant possibility thinking or significant improvements is going to really be interesting.
It's going to be fun.
Yeah, I think it is.
Well, that gives our listeners a good view of what we're going to be discussing and how we're going to be talking to guests that haven't been featured other places and other viewpoints that are unique. So we plan to make good use of your time with brief, impactful conversations. Each episode is going to be about 20 to 25 minutes, and it'll be perfect for a short commute, a brief cardio workout, or while making dinner for your family. You can find The Spark on your favorite podcast platforms like Spotify, Apple Podcasts, Amazon Music, Google Podcasts, and more. We'll be hosting episodes on our website as well, so you can listen there. Please hit subscribe, explore the show notes, and engage with us.
Thank you so much, Rachel. I'm really excited to be engaged in this with you and really excited to talk to this list. When you and I sat down and started putting together our list of people that we could invite onto this podcast, I was inspired just by, you and I, two people came up with 18, 20, 25, 30 names, right?
Yeah.
Of people that we know are doing really inspiring things. So I'm really looking forward to doing this with you. I think the Spark is going to be a lot of fun. Mm-hmm. We're going to try to keep it really fun and exciting and jovial with our audience as well. So hopefully you're geared up for that as listeners and surprised subscribers. But let's spark the innovation together that's going to transform better patient experiences, better human experiences in healthcare, and it's going to be fun.
All right.